Buenos and Hafa de Guam. You're tuned in to K57's Vet Talk, broadcasting live on 99.5 The Shark, KZGU, Manglona, and KGUM, Hugatnya, Guam. I'm Fred Flores, and I'll be your host for tonight, holding down the helm for the vets on the island and on the radio waves and the internet. I am a member of the Iraq, Afghanistan, Persian Gulf Veterans of the Pacific, the Wounded Warrior Project, and the Disabled American Veterans. In studio tonight, we do have Uncle Dan back in there.
Good evening, veterans. My name is Dan Mendiola. I am the president of the Vietnam Veterans of America, Chapter 668. Good evening.
And before we get to whoever else is in the studio, I don't want to let that out just yet. We do have a few announcements to go over, and with that, I'm going to go ahead and get into them so we can get on with the show. Veterans Crisis Hotline is 1-800-273-8255. That's 1-800-273-8255. It is open for all crises, no matter how big or how small. If you need someone to talk to or need help with a situation, please call and speak with a counselor. Guam Veterans for Veterans Facebook page. If you go onto Facebook, we do have a Guam Veterans for Guam Veterans, and that's set up so that all Guam veterans can voice their opinions and voice their concerns on Facebook so that we can read them out on the radio as well. And, man, I really don't know the link, but if you go on Facebook and type in Guam Veterans for Guam Veterans on the search engine, you will find that. Also, the VFW is hosting a scholarship contest, and this is coming from Dave Ellers. The Veterans of Foreign Wars is offering college scholarships to 9th through 12th grade high school students and 6th through 8th grade middle school students. And it's called The Voice of Democracy. High school students are invited to write and record an 3 to 5 minute audio essay on the patriotic theme of My Responsibility of America. The top national prize is $30,000 scholarship, and the first place state winners receive a trip to Washington, D.C. For the Patriots Pen, that's the middle school students are invited to write a 300 to 400 word essay on the theme of the America I believe in. The top national prize is $5,000, and that's it. For more information, if you need, you can go to the website http://www.vfw.org/VOD, and that's for the Voice of Democracy. And the other one for the Patriots Pen is http://www.vfw.org/patriotspen/ again. And the contacts for, I believe, post 1509 for the Northern Schools is Alan Jackson, and his email is ajack19130@yahoo.com. Southern Schools is VFW Post 2917, Bill Bradford, and his email is Big W, small W, Bradford@live.com. That's Big W, small W, Bradford@live.com. In studio tonight, we do have guests. We have the Guam Veteran Affairs Office Administrator, Mr. Martin Manglona, and with the GRMC, Eric Plinske, Director of Corporate Affairs, Guam Regional Medical Center, and he is the insurance expert. And with that, I'll let them introduce themselves. Mr. Plinske, please go first.
Fred, Dan, it's a real pleasure to be here tonight for the veteran community. As you mentioned, my name is Eric Plinske with Corporate Affairs at Guam Regional Medical City. I'll just refer to it as GRMC from here forward to keep it short. We're real proud to be able to serve the entire veteran community here in Guam with all our services now. So our main purpose for me to be here tonight is to let the vets know we can serve you here on island with all the services that we do have available. And Martin, I'm proud to be next to. I've known for many, many years, and we both come from Saipan. And looking forward to working closely with Martin to make sure we serve the veteran community as best we can and get the feedback from the vets.
I'm Martin Manglona. I'm the administrator for the Guam Veterans Affairs. This evening I'd like to discuss on the choice card. There's a lot of confusion out in Guam, so I'll clarify this evening. And if you have any question, you could call this station. Also, I'd like to talk a little bit about the upcoming Memorial Day, 30th of May this year. We're going to be hosting mainly for the KIA that died from Second War, Korean, Vietnam, Afghanistan, and Iraq. So it'll be a little bit different ceremony this year.
Okay. If you don't mind, before we do get into everything else, though, Mr. Plinske, can you tell the audience exactly who you are at the GRMC? I know I said you're the insurance expert, but we'd like to know a little bit about yourself and what you do at the GRMC, sir.
Well, that's a good question. My title is in corporate affairs, but it does. I came from Stable Insurance prior to being with GRMC, so I think our CEO, Margaret Bengzone, and medical director, Dr. Mike Cruz, and Francis Santos, the chief of administration, knew I had a background in insurance, so they had me more involved with, working with the health plans, private and government. And so I've been working with the Veterans Administration. Of course, TRICARE is another program for active service, active duty military, and Tri-West is the program linked to the Veterans Administration for the insurance side. So as we've navigated that path to getting accredited and certified with the Centers for Medicare and Medicaid Services, as well as the VA themselves, and we've accomplished that as of last month, and we're now green light go, to serve the community and with all of our services available. And, that was a big challenge just as we're a new hospital, ramping up and getting launched. We had all of the steps we had to take to be able to get to the point where we could provide all our services to the community. Prior to last month, we were only really able to provide clinic services, consultations with a specialist. A patient could come in and see a specialist in the clinic, but we couldn't do things like outpatient surgeries, radiology, inpatient stays, unless it was an emergency, then we could. But we were limited on those resources because of the accreditation and certification. Now we've got that. We can do all of those things for our vets.
When GRMC first opened, I asked this question, and I hope that we have an update on this. Do you guys have a nephrology department now as well?
What we do, Fred, is we have for inpatients. We are not set up to do outpatient, what we're talking about, end-stage renal disease. I think you're talking about hemodialysis. Is that what we're talking about?
Correct. Dealing mostly with like the lupus and the people that need that, because there are veterans out there with lupus who need a nephrologist to check on their kidneys, their white blood cell count, and all that. I was wondering if you guys had a specialist on hand that actually deals with the nephrology and whatnot, because I did ask this question when GRMC first opened, and they didn't have one at the time. So I was wondering, is there an update to that?
Right. I will answer this one the best I can, but my understanding, I'm not on the medical side, I'm on the administration side.
Sure.
But Dr. Safa, I believe, in the firm that he's with, which is a private facility outside, we have contracted to handle our nephrology services, which I think are primarily for hemodialysis. This is for inpatients, though. We don't see patients need their 3 days a week hemodialysis or related type of kidney related and a nephrology related care. So if it sounds like they're needing a specialist visit, they're likely going to see him at a clinic outside the hospital. If they're a patient for something, they've got a heart attack, and by the way, they need nephrology while they're now we're going to have him come in and take care of them for all their nephrology needs. But if they're just needing specialty care like outpatient, that would not be done at the hospital, my understanding of where we're at right now. So we're there to make sure that if a patient is admitted and they need the nephrology service, we've got those, and he'll be in to take care of that, but not in an outpatient clinic setting.
So it's an emergency status type.
Well, emergency, or they came in, they were admitted, not necessarily through emergency, but they're an admitted patient in the hospital, and they have a need for nephrology. Awesome. We can serve them, yes, but they won't be coming in a clinic to do a outpatient visit that way. Does that make sense?
Yeah, no, that makes perfect sense.
It does, but I do see some type of a need for generalized procedure things, and I understand GRMC is up and running, and from what I've heard, good stuff happening. It's just that it's a matter of once we get things rolling, procedures are going to have to be straightened out, and sometimes and talking as far as the veterans are concerned. And Eric, the thing that I'm concerned is I'm always a guy with the onset. And like I said, the big news was that when they came out, GRMC is now taking in veterans. So from that general perspective, maybe we need to, if you can just come out and give us some procedural type before a veteran goes up there for anything whatsoever. Emergency, I understand, is one thing. You go straight, regardless whether you're a veteran or not. So,
I think I might.
Right.
I
If
will,
you guys could, any one
I
of
will
you.
let Martin
any
here,
one of
who's got a lot more
Right.
background on the different programs with the VA and the choice card and the PC3, all this.
That's
kind of
what I
language.
was trying to get
But
at.
I will then follow up. Martin, could you take the
let
lead on
me
this?
let me just thank first the following people that make this happen. Last year, July, when Pfeffer came here to Guam, director on the West Coast, Mr. Thomas Driscoll, and also Craig Oswell, to include the director of Tri-West, Carl Kawakawa. So they've been working on this for a few months. They as a matter of fact, we have finally approval on 7th of April last month to have Tri-West. They're certified now to take care of veterans on choice card and also on TRICARE and Medicare. So effective April 7 last month, when VA approved the GRMC to take care of veterans. But first of all, let me inform all veterans out there, all registered veterans in the Pacific, Hawaii, Guam, Sinai, and American Samoa are choice eligible. All registered veterans in the Pacific who are choice can utilize two programs. One is Choice 40. At Choice 40, when a veteran's calling online, he has a choice card. He call 1-866-061-8198 and can request without having to go to VA. That's Choice 40. A veteran goes directly to GRMC and uses choice card number, call in to choice card. And in Hawaii, we hired 49 operators. Each operator will have a registered nurse online. And the veteran, when he calls in, they will ask him his last four. They will check his record, and they will tell him they will get the approval from Tri-West. Once he get approval, he could use the facility at GRMC. That's choice 40. Now, first choice, when a veteran goes to CBOC will send an appointment to that particular veteran to the outside providers. Yet,
You still got to go through the same procedures,
yes,
correct?
Tri-West has to approve that.
Okay.
And if they go to PC3, they call it PC3, which choice first. Each veteran that enroll on the choice card on the medical side, they break into category 1 through 8. If a veteran is, let's say for example, a veteran that's multimillionaire, he come under category 8. So he will not. The federal government is not going to pay for his medical care.
So it's like a by priority.
Right, they go
Okay, so
priority
it's
one,
just like the CBOC.
Yeah.
If you're priority 5, you're
priority 1 to 8.
Yeah, exactly. So when you call for the first choice,
Yes.
it's by priority,
Right.
but you still have to go see your primary care.
Priority 1 is people that has 50%
Roger.
to 100% disability.
Mhm.
They go by priority. 2 is 30% to 50%, and 3 is people has Purple Heart or Congressional Medal of Honor. They go by
Understood,
priority.
understood.
And if you don't have the when you apply for medical care,
Mhm.
you fill a 10-10-40 easy.
Yeah.
And they put your how much money you make, your salary, you and your wife. So that determines your category.
Awesome.
That's how it works.
So I have a question on that.
Go ahead.
On a Category 8. Let's say that a Cat 8 veteran does have a service-connected disability, let's say 15% or 10%. Could he not be seen or will he be eligible to be seen or referred by VA for a service-connected
Yes,
disability?
that's absolutely right. Because
Even though he has a lot of money.
Even though he has a lot of money,
Yeah.
but because of service connected.
Okay.
Okay.
Well, that's
I think we're just
pretty
trying
good.
to establish
Yeah.
that way
Yeah.
the
No,
audience
that's
is
good,
aware. Yeah.
because
Service connected.
You know.
Yeah.
So once everything is established by Choice First or the Choice 40, from there the GRMC takes over, correct, Mr. Plinske?
That's the way I understand it. I think the way I'm understanding what Martin was explaining is there's the choice card will say the choice 40 is where the vet has a choice to either go through, let's say they're at the CBOC, it's really their primary care physician, right? They're either at CBOC or they're at a clinic, American Medical Center, Pacific Medical Center. I think there's
Wherever
a variety,
their primary
right?
care.
And so they start by getting a doctor to write a referral, for a service. And if it's a choice 40, the patient, the vet, has a choice of either letting the doc contact TriWest to notify them that the patient, the vet, wants to go to appointment, let's say a GRMC, and then TriWest is going to call the vet to try and find out, hey, what's a good time and date for you to go to an appointment? Because we, the TriWest, are going to call GRMC to try to set that up for you.
Sure.
And then they're going to do that, and if they can set it up or get an alternate time, they're going to call the vet back, I guess, and confirm we got you set up for this date and time. Or, the vet could, and this is the choice, the vet could call the 1-866 number that Martin just said and do it themselves. Yeah. Speak directly to TriWest. That's if they have the Choice 40 card. But I guess if they have the PC3 card, I think that stands for Patient-Centered Community Care, if I'm not mistaken.
Veterans Affairs Pacific Island Healthcare System.
Right, through the Pacific Island Healthcare System.
Go.
That one is, there's no calling an 866 number. I think it's a standard, let the primary care physician send a referral, and, TriWest is going to get notified. They're going to call the vet once again to check on a date and time, and then they would set up the appointment. What's not likely able to happen unless you're in an emergency is you just come walk into GRMC and say, hey, I want to get some treatment here. That won't work out so well.
So what I'm understanding here is number one, CBOC is the primary place to go for these veterans. If they don't know where else to go, they need to go to CBOC or call CBOC.
Well, I think the misconception is, too, that they can just call the choice card and they're going to get the referral approved. But that you still need to go and talk to your primary care. Yeah, you still need to speak with your primary care in regards to your problem, because you're not going to go get acupuncture, as we were speaking out on the green room, and you're not rated for that, or you don't have a prognosis or a symptom for that.
Yeah, you have to be ready because, as you know, I talk to a lot of veterans out there. And a lot of them are saying that they could, when they wake up in the morning and they don't feel good and they want to see a physician, they can call the 1-800 number. I mean, the toll-free number. So,
well, I think that's for an appointment, 30 days out, meaning you specifically need. But what we're talking about is the specialty stuff. So, I'm not going to go to GRMC or call the 866 number and say I need to go and get physical therapy at GRMC without consulting my primary care. It just won't happen. The primary care is going to have to set that referral to get approved by Hawaii, and then TriWest will contact the veteran and let them know that you have a choice to select from GRMC or the other people. So I want to make sure that the audience is aware that there are still things that you still have to go to your primary care and talk to get that referral done. And I believe that's what you're dealing with currently at the moment, correct?
Right, and we do want folks to know that we don't do primary care right now at GRMC. So there's a lot of fine primary care facility, including the CBOC. And so that's where their primary care starts, and we are specialty care and emergency care, and admitted hospital care. So that's where we fill in. But for primary care, you start wherever you're seeing a doctor. And if you've never gone to a doctor, I think, Dan, you're right. Well, go to the CBOC then, I think, if you're a vet, and get started there. And, you always have the choice to go to another outside clinic. But you want to go where they have the best information for you as a vet. I think CBOC would be if you aren't already at another clinic.
Correct.
The other thing I want to say, if a veteran having problem on appointment, come to the office because I have a direct link with TriWest and also in Hawaii, the PC3. So if they get any problem that getting an appointment for over 30 days, come to the office and we'll take care of that.
And Martin's got my cell phone, so I know if there's any issue at GRMC, he'll be calling me any time of the day or night, and we'll get that resolved as well.
So are you able to talk about the statistics of the referrals and how everything's been handling? I mean, what's the influx been like since you were able to fully take on a lot of the veterans over there at GRMC? I mean, I know you were only doing specialty care such as, physical therapy and like consultations in regards to like orthopedics and whatnot. So now there's an open range, and I know a lot of the audience are wanting to know, is there an influx of veterans use over there at GRMC? And what has it been like since you've opened up to the choice program to utilize the full facility?
There has been, Martin.
Let me answer that. Since they, as a matter of fact, they just approved last month. As a matter of fact, I just went over there yesterday. I have speech therapy and physical therapy because I have a stroke last month. So they take care of me at GRMC yesterday.
Okay, well, I guess I'm asking,
Yes,
what's the influx of veterans been like? Is it greater than just utilizing the specialty, or is it like steady at a certain rate? Because you see the referrals, and you're the insurance expert.
Right. I don't on a daily basis look at admits and things like that, but we certainly have seen a scaled up level of vets coming in and active duty, and TRICARE as well. Because of the fact that we're now accredited and certified and they can access all these services. Some of the more popular that I would highlight, for instance, our rehabilitation program. We have, I believe we have 4 physical therapists. We've got, I think, 2 speech therapists and an occupational therapist. I understand that prior to us opening, there was like a 3-month backlog anywhere you wanted to go to try and get physical therapy, and including Anderson Air Force Base, where even the military brass came down, and they were giddy when they saw what we had to offer because it was large facilities with a strong team.
Yep.
And no backlog. I mean, you could almost immediately get an appointment and do your therapy, and that's, I think Martin was able to come in for an appointment, like you said, fairly quickly. And so that's one area that's been real popular because the military and the vets have not been able to access that due to the backlog at all the private clinics before we open. So we're proud to be able to help that and reduce the backlog for the whole community. Other areas that I think we've seen a real need is in our neurology and neurosciences, right? We have some outstanding technology, and the team is top notch, doing procedures I didn't even know were possible. For instance, Martin was talking about a stroke. We have some advanced stroke care where one of our physicians, Dr. Shea, can actually go in if it's known, I believe, and I'll speak in layman's terms here, not being a doctor, but say it's been known there's a clot or something that could burst and cause real damage. He can go in with a needle. I think he went through the thigh, works his way up, somehow meanders up there, pops the little thing, sucks it out, no stroke. So it's advanced level stuff like that, where maybe even as the patient could be gone, leave in a day or two. So these kind of things are possible here. We have advanced cancer treatment. We're talking radiation oncology as well as chemotherapy, right next door to each other. And in fact, the radiation oncology, we use a machine called a linear accelerator. That's the thing that beams the radiation. This machine, and we're told from the manufacturer, a company called Varian, it's a TrueBeam machine. It's the most advanced model on the market in all of Asia. That we are the first hospital that has this model, not in Japan, not in Korea, not in Jakarta, Indonesia. So we were the first one to get this upgraded model. It's certainly the most expensive piece of equipment in our hospital, and we're able to treat patients in minutes, what could take, possibly nearly an hour, because of the advanced mechanisms involved and the ability to treat cancer very efficiently without creating mitigating damage to tissue around the tumor.
Well, if I would just kind of like put something out, because of a lot of the complaints of the veterans are. And the families, if the veteran has to be, let's say that CBOC is getting ready to say you may have to go off island. This is telling a veteran. Let's say that you have the facility and the expertise to perform or do the treatment up at GRMC. Is CBOC ready to refer
Yes, as a matter of fact,
instead of going off island?
Yes, we have one guy that was treated hyperbaric chamber. Instead of going to Hawaii to be treated over there, I talked with Dr. Acuna.
Acuna, yes.
So he's being treated instead of flying him to Hawaii to be treated at hyperbaric chamber.
And the reason why I'm asking is there's a lot of impact and financial problem
Not only that, but the
associated
family
with
support.
the families. Yeah. So that's good. Basically what I wanted.
Yeah, absolutely. We are, and CBOC and TriWest are all very supportive and ready to refer over the patients for the services we have, that we can provide. I will highlight there are, because we were at the Vets Conference recently, the annual benefits conference over at the National Guard unit, and a gentleman that was a vet, and he was a bit frustrated. He voiced that to me as I was presenting at the end because he evidently came to the hospital and needed something called an angiogram. And he said we weren't able to provide that. He was frustrated by that, and I needed to call the surgeon actually who does the procedures to find out that we are, once again, we're a new hospital. We're ramping up. We're not full scale at this point. We have about 60 out of 130 beds available right now. We're still growing. Our cardiac program is something in its infancy. Open heart surgeries led by Dr. Noel Concepcion. This is a program that's being developed. We've done some surgeries already. We did 4 in December, very successful, but it's not a ready-to-roll everyday thing. If you're needing a heart surgery right now, you will not be able to get that at GRMC. We're still building that program. Now, there's certain procedures like an angiogram. It's a test on the heart to see what kind of work you need. That one, if you're really high risk, you need to have a cardiothoracic surgeon, an open heart surgeon on standby in case something goes wrong during the angiogram procedure. The gentleman, was a serious enough case where he needed that. We couldn't provide the backup, therefore we recommended he would go off island. So there are some things that we are limited on at this point. That's one.
Okay. And like I said, it's interesting to see the evolution of how GRMC first opened up and to see where you guys are now, because I've actually was there when only the first 3 floors were open. Now I believe all 5 floors are open. So I had a family member. I'm not gonna say the situation, but I know they were staying in the ICU and they should have been in the not the intensive care, but the other one where the constant care, or like they're always checking on them due to the heart.
Probably the ICU, intensive care.
No, not the other one. After you got done in a procedure, they isolate you in another place, not the ICU.
Okay.
But like just to make sure that all your medications and you're able to like eat or whatnot outside of the intensive care unit.
Okay.